Hello, and welcome to Quality Matters. I'm Rachel Harrington, NCQA Senior Product Strategist, and I'll be the host of today's episode. Digitally enabled wellness and condition management is a growing area of focus in healthcare, and patient engagement and empowerment are at the center. Our healthcare system will not achieve the outcomes we aim for if we're not reaching outside the four walls of healthcare and meeting people where they're at. This is true for populations near the top of the risk pyramid, people who are actively managing chronic conditions and who need support and self-management. But it's also true for populations further down the risk pyramid, people who are trying to stay healthy or reduce their risk factors before they can progress. At NCQA, we've been working with the field to advance high-quality wellness and condition management, and doing this in partnership. We convened two groups to help us. In our innovations work group, payers, vendors, health systems, patients, and associations helped work to define what quality looks like. Alongside the work group, our Measuring Digital Engagement Learning Collaborative really got into the details, tackling the practical questions of data and measurement and how we construct meaningful, feasible metrics that move the field forward. In this episode of Quality Matters, we'll explore this intersection of health self-management, quality, and technology, and what it means for the consumers and patients who are using these tools. Today's guests will help us tease out this discussion with experts from the employer, vendor, and patient perspectives. We have some great expertise around the table today from different perspectives on the topic. Our guests have also been active partners in NCQA's Measuring Patient Engagement with Digital Health Solutions Learning Collaborative. It's a mouthful there. And helping us dig into the details of what it means to practice and measure meaningful engagement with consumer-facing tools. So I am really looking forward to today's conversation. I'll start by asking each of you to introduce yourself and tell us a little bit more about your organization, your role, and kind of how you personally got involved in the wellness and condition management space. So Peter, we'll start with you.
Thanks, Rachel. Pleasure to be here today with you and Kevin. My name is Peter Robertson. I'm Senior Director of the California Quality Collaborative, which is a program at the Purchasing Business Group on Health. Here in California, I lead technical assistance programming with purchasers, payers, and provider to improve the quality and affordability of healthcare for Californians. And collectively, our stakeholders represent over 20 million Californians, which is half the state's population. More broadly, the Purchaser Business Group on Health represents a national coalition of over 40 private employers and public purchasers who spend over $350 billion each year on healthcare for their employees. So our mission as an organization is to really advance the quality of healthcare, affordability of healthcare, and in doing so, bringing forward innovative solutions within the delivery system. So I think the focus on wellness and condition management solution really aligns with our organization's mission very closely. We are constantly exploring ways to elevate what we're doing across the healthcare delivery system and ensuring where we are spending money, that it's leading to the results that our members desire, which is high quality, affordable care for all Americans.
I think that's a mission we can all get around here. Kevin, I want to pass it to you. What's a little bit of your backstory here and where is your interest in this space?
Yeah, thanks, Rachel. So great to be here. Thanks for having me, Peter. Nice meeting you as well. My name's Kevin Masci, and I lead clinical affairs at Omada Health. Who's Omada Health? We're basically a virtual first care provider. And what I like to say is we help people manage what are some of the most complex and costly chronic conditions in the U.S. So think things like prediabetes, diabetes, hypertension, obesity, weight management, cholesterol, and then of course MSK, because that's always surrounding those chronic conditions as well. I'm a clinical pharmacist by training. My role at Omada, though, it really centers on making sure our programs are clinically rigorous and that in a way we're truly driving meaningful patient outcomes. What I do is I really translate the evidence to practice. We try to make sure our care teams are really working to meet members where they are, and then we're ensuring what we're building actually does improve outcomes and quality of life because our customers, of course, demand that of us. I know one of the questions is like, hey, how did you find your way into this space? I think it was like a lot like many clinicians. I had this personal experience that really got me here. I kept seeing this unfortunate pattern in traditional care where people would leave a visit from their doctor with good intentions and a treatment plan, but then what happens? Life happens, and they would struggle to get the care they needed, and they felt overwhelmed. And so I thought, man, how can I be a part of changing that story? I always wanted to create models of care that just didn't show up a few times a year, but they could really walk alongside a person in what I like to call the messy world of change. That's what drew me to Omada and probably keeps me here. It's this opportunity to really build programs that are grounded in science, that are delivered with compassion, and really designed to meet people along their journey to better health and wellness. It's a great privilege to do it.
Yeah, that definitely resonates personally. It's funny how many people you talk to have that personal experience, that story of, no, here's why I'm in this space, and here's why it matters. And hearing you both bring up this focus on outcomes and on value, are we really investing in a way that makes a difference for people's lives and for the health that we're trying to achieve? So we're talking broadly today about these digital solutions, digitally enabled consumer-facing tools, programs, applications that help individuals engage with their own health. That could be healthy behaviors, behavior change, Kevin, like you said. It could be things like how they're managing chronic conditions like diabetes or high blood pressure. Are they getting the follow-ups they need, medication adherence, things like that? So, setting that stage, I'd like to start with a kind of fundamental question. Why do these digital health and wellness solutions matter from your perspective? What really are we trying to achieve with them? So, Peter, what are your thoughts from the purchaser's perspective?
Thanks, Rachel. I think, broadly speaking, the healthcare system as a whole doesn't work for a lot of Americans. It's very costly. Access is a challenge in many parts of the country, whether folks live in rural parts of America or in urban parts of America where we have shortages of providers, hospitals, so on and so forth. And in addition to that, people don't necessarily achieve the health outcomes that they desire. And so as an organization, we're very eager to sort of push the boundaries of what healthcare delivery can look like in this country. And I think these types of services and platform and vendors are really at the forefront of how can we think about providing different modalities of care that may suit different patients, different communities better than the norm that we have today. So we're really encouraged by the work that many of these organizations are leading. And I think helping individuals achieve their highest possible health outcomes. And I think for our members, what does that mean? It means that people are able to come to work on a regular basis. They're not ending up in urgent care. They're not ending up in the hospital system. That their health is managed well by a variety of different resources those individuals have access to.
That certainly resonates. That concept of like the healthcare system we have has not been achieving the outcomes we want. So how do we get creative and find new and innovative ways to do this? Kevin, how does that align with your perspective on sort of the solution and the provider side?
I love everything you said, Peter. I think when I think about these digital health solutions and why they matter, I think, unfortunately, we got to start with a simple but hard truth. It's everything you said. Healthcare in our country is not getting easier to navigate for the people that need it most. I think of myself as a clinician. Sometimes I don't always know how to navigate the system. But I think it's good to start with the facts, like you said. I mean, chronic conditions, they affect more than 3/4 of U.S. adults. 90% of the roughly $5 trillion spent in annual healthcare goes to treating people with chronic and mental health conditions. So it's not easy. I think what resonates for me is behind those big numbers are actually real people. And it's like you said, Peter, they feel lost, they feel confused, they feel alone. They're trying to manage these complex conditions. And really, as you described it, a system that wasn't necessarily designed around their daily lives. So the buzzwords are what you say. Care is deeply fragmented. Patients continue to bounce between provider and health system, and they just simply get the care they need. So I think this is where digital health and wellness solutions can play an important role. I'm not ever going to say they're a silver bullet, but I think they feel a critical role in the gaps between visits. And if you do it right, they can create that continuity and make high quality care and support feel convenient and feel accessible. But I don't think that's like the end of the story. I think if you do it, you have to make sure that these digital tools are reliable, they are associated with better health and outcomes, and they drive engagement. I think these digital tools need to be more than just things like pushing reminders. They need to make sure people are feeling heard. Having a voice in today's fragmented healthcare system means a lot. I think some of the most important things I did as a pharmacist was simply sit back and learn and listen And when you listen, you feel like you give people a voice to really connect.
I wonder if I could just build off what Kevin was sharing there. And I think the words that struck out to me were fragmentation. And I think a lot of the times we're seeking solutions within the healthcare system that worsen fragmentation. And so I think it is critical that these platforms are integrated within the larger healthcare system. I think we put too much emphasis on the individual, on the patient, on the employee to be that self-navigator. Their primary care team and our organization is a huge champion of primary care here in America. They need to know that their patients are accessing and utilizing these services. They need to understand what goals they're setting within those platforms. And then they need to understand if they're achieving the outcomes that they've defined. And so I think critically, it's that as we introduce these tools, that there's the robust coordination of care between these different settings and venues. And I think, as Kevin shared, that really lifts up the potential of this and not further fragments our delivery system.
Very, very well said.
Yeah, Peter, I can imagine people hearing coordination of care and immediately getting anxious there. But it really is a coordination effort, because if the systems aren't set up to do it, if the technology isn't set up to facilitate that, it's going to fall on the patient or their caregiver or, their family member who's helping them. And that's not something we want to contribute to here. So how do we set up our systems and our approaches so that these different things work together, that the in-person delivery, the primary care relationship, the specialist relationship, and the patient and the digital solutions are part of working towards the same goal. So Kevin, you already mentioned something that is really top of mind when we start conversations around this, which is engagement, right? We can't start measuring outcomes unless we can identify the population we're targeting, engage them, successfully change behaviors, and then you start seeing that impact on outcomes. Everybody agrees engagement is critical here. I don't think there's any question, but there are a lot of different ways to define that engagement. So from your perspective, Kevin, what does engagement mean to you or to Amada, and what does it look like in practice?
Yeah, it's a wonderful question. We have a grounding philosophy that says you can't expect great clinical outcomes without engagement first. But as you mentioned, not all engagement is created equally. When I think about engagement, how we think about it at Amada is it's this idea that we're not in the business of driving clicks and downloads. That's a different type of business when we think about virtual tools and solutions. We're really in the business of changing healthcare trajectories and really doing everything we can to bend the curve on population health. So what that means is we have to have meaningful engagement, and that's anything that reliably moves a person closer to better health and better quality of life. Did they take a meaningful step toward managing their condition? That can be by completing a tailored lesson that shifts their understanding and knowledge, because knowledge is power. It could be having a real conversation back and forth with our coach and care team. It can be that recommendation of medication adjustments in partnership with the provider, or it could even just be building new behavioral habits that actually stick and stack over time. So I would just say in practice, what this looks like for us, it's people coming back regular over time, not just in the first 30 days, right? You got to drive continued engagement. When we're talking about chronic condition management, it's a cyclical journey. Like some days are great, some days are not. So we have to hope people are sharing their blood sugars with us, their blood pressure readings, that they're setting goals with our care teams, that we're problem solving together, that when something happens and we're reaching out, it feels like we're reaching out at the right moments of time, not before what Peter mentioned earlier becomes a crisis. The other thing is when we talk about engagement, is a clinically guided component to this. We're looking for patterns. Are people with uncontrolled diabetes, are they actually improving their time in range? People with cardiovascular risk, are they increasing medication adherence and persistence? Are they changing their nutrition and activity behaviors? And then are they sustaining those behaviors over time? It's about making humans feel like humans, making it not transactional. If engagement feels transactional, then that's not possible. So we blend this idea of technology and human-led care so people feel heard, they feel respected, they feel supported. And again, it's not, we're just managing that. Like managing just seems so sterile and technical. It's about an experience and a relationship that really drives that engagement and those outcomes.
We've discussed how we both have a little bit of a pharmacy background here. It reminds me of the shift from compliance to adherence, like this sense of managing, of this sort of paternalistic view on how people are working in their health, to a more collaborative view and a more partnered view on what that looks like. So you gave a couple of examples of engagement and sort of how that connects to outcomes there. Peter, from the purchaser's perspective, from your perspective, why does it matter if we define engagement consistently? Does it matter if we define engagement consistently?
Yeah, I think that's a great question. And I think from sort of our members' perspective, they're looking at a variety of different solutions out there that cover many different clinical conditions and wellness spaces. So I do think having some consistency with which to evaluate a certain platform, tool, vendor is very helpful. And so I think at a base level, to your point that we've already discussed, like engagement is beyond somebody initiating some type of interaction with a certain solution or platform. That's a great starting point. And clearly, if we're procuring something, we'd like to know that people are actually logging in and using it. But I think, as Kevin mentioned, it's really thinking about what does that longitudinal relationship with platform look like? And I think as we've talked about with the NCQA and within the work group, I think we've really focused on, well, are patients in there establishing their own goals? And I think that's really important. How are patients driving their interaction within this platform and establishing their own personal goals? And I think subsequently, what is the outcome of all of that? And I think Kevin mentioned sort of clinical outcomes. And so we may be looking at like blood pressure control or blood sugar control. We may also be looking at things like patient-reported outcomes. I think of lots of products in sort of the behavioral health space, and they include assessments for depression or anxiety that patients can complete and report on a regular basis. That is really valuable information, and I think for all members, really helps us understand when we're investing in the platform, what's the potential of it to improve the care of our employees, of the communities that we're touching this. I think that's really crucial to be able to connect that end result, those improved outcomes, even those self-reported patient outcomes, which I think are really valuable. And I think to Kevin's point, allowing them to customize their own sort of care experience, care journey to how they're investing in the product up front.
Because you said some things that are I think super near and dear to my heart, and I love that you said it. And Rachel, you mentioned this, like we have to move out of this paternalistic like mode of care. What I've seen and what you've mentioned, Peter, is when people feel like they have a role and they're accountable in their healthcare, they tend to take more responsibility as well. You know, we don't want to just tell someone what to do. We have to really understand their journey and the factors behind their journey as well. And when we can get them to focus on their goals, little steps incrementally, because they feel like they're part of the solution, not just along for the ride. Wow, what a tremendous impact you see in engagement and outcomes. I loved that you said that accountability piece is important. And how do we use these digital tools effectively to drive that? It's super well said. Thank you for sharing that.
It's funny because effectively what we're talking about here is fundamentally patient-centered care, patient-centered delivery of services here. And as a healthcare system, we've struggled with that so much, but it seems like such a natural fit for this space in particular. We've already touched on value a little bit. It's a word that's popped up, I think, value, outcomes, investment. So let's talk a little bit of value-based contracting here, right? There's a strong interest in this space in terms of supporting on the solution side and really having the resources to do creative work and break out of a kind of traditional per member type approach there. And then on the payer purchaser side, you want your outcomes, right? Like you want to make sure that you're investing in solutions that will deliver. But it takes some infrastructure to pull off a successful value-based contract. So, you know, what are we looking for in terms of outcomes of these solutions? Like really specifically, if you were to build, Peter, one of your constituents was to build a value-based contract in this space, what are some outcomes that they might be considering there?
I think I would just go back to my comments from a few minutes ago. And I would start with, I would think about clinical outcomes related to specific chronic conditions. I would think about patient-reported outcomes. And then I would subsequently, if I was to take that conversation further, I would think about healthcare utilization for those individuals more broadly, right? And so I think my aspiration for these types of products, and I think as Kevin has described, These are really supplementing access. They're providing alternative mechanisms to engage within the healthcare system. As a result of that, I think it's going to be wonderful if we can say, as a result of this many people participating in this, they didn't end up in urgent care. They didn't end up in the emergency room. They didn't have an inpatient stay because they're better able to manage their care, hopefully at home with the support of these digital tools and their broader care team. So I think that's really big, right? And requires a lot of coordination between many different partners. And frankly, information that the vendors alone don't necessarily have access to. But I think when we think about the implementation of this in partnership with purchasers and payers, how can we bring all those threads together to really get a holistic understanding of how patients are succeeding when they're participating in these types of programs?
Yeah, I love that you bring up that no one entity sits on all of the information needed to describe that value impact, right? And I think we have to be honest about that when we start talking about the outcomes that we expect to be demonstrated. But if we probe on this, or if we play it out a little bit further, what types of data could a vendor bring to the table or a solution bring to the table that might justify higher value-based reimbursement or might justify performance bonus? Is it like specific utilization data? Is it the clinical side? Like what are some of the data types that they might look for?
If we're talking about like chronic condition management, I think clinical data is crucial. I would also say, I think bringing together what these vendors know and like where the solution really succeeds and potentially venues where it's not as successful. For example, like if we're talking about diabetic patients, are people with really poorly controlled diabetes not as successful as potentially those who are moderately managed and could do with some improvement? I think that level of understanding and precision of where we have the most success with this type of solution, so we can tailor the offering, to certain individuals, certain employees who may benefit the most from it. I think that sort of stratification is really meaningful to employees. And then I think to the conversation earlier, this sort of what does longitudinal engagement look like? I think generally we see a huge spike of activity as people come on board and then it drops. But how long is that maintained? So what set those expectations up front? Most people will be engaged in this platform for 6 to 9 weeks, 3 to 6 months, and being very clear on that. And then over that longitudinal period, when can we start to see those outcomes? So what do we understand about the timing related to their engagement and when we can expect those outcomes to arise?
Yeah, Kevin, I feel like we're talking about you on your behalf almost. What are your thoughts on this in terms of the question of data, stratification of populations, and sort of how we navigate these questions?
Going back to the value-based contracting event, I think it's so important. I think we've been trying to move this way in healthcare for a long time. I think we're getting there. I'm not sure if we're completely there yet. I think, Mata, our philosophy has always been sort of what we talk about. If we say we can improve outcomes and we can deliver value, then we should really be putting meaningful dollars and rents behind that promise. And what I've typically seen is like the most successful models are the ones that tightly line how the care is delivered. And so it's not necessarily, at least in our model, it's not necessarily about a flat per member per month fee. This is where we go back to engagement. We like to do what we call activity-based structures that recognize like real clinical relevant engagement. And then when someone completes those activities, again, if it's lessons or their biometric device check-in, sustaining context with a team, that's how we get paid. I think, to Peter's point, look at the clinical science, look at the guidance. How are you doing your researching? We always like to add performance guarantees into almost every one of our contracts. We think hey, we got to tie a portion of our fees and outcomes at risk to our partners. So to your point, if it's like reductions in A1C or blood pressure, we know what we need to do to move the needle clinically to drive population health improvement. So why not layer some performance guarantees in there? When I'm having discussions from a clinical standpoint with our customers, I think there's really 3 things that we have to look at when it comes to measurement. It's number one, very closely aligning which populations we're accountable for. Rachel, I heard you say there, as you think about attribution, there's a lot of part of the healthcare system that works together, but what part of the population are we specifically accountable for? Then I think it's important to just define what those metrics are and what success looks like. When everyone has a clear understanding of what we're shooting for, we have a better chance of achieving those goals. And then, Peter, you mentioned, what's the time horizon to see realistic clinical change? I think, customers sometimes want to see things overnight. I want to see things overnight too, but we know chronic condition management doesn't really work that way. The way you design the program, the outreach, the intensity of support, depending on the type of person, the acuity, you got to really think about those things. I think the final thing I will say about this, at least in terms of how you think about value, is on just like the clinical metrics. I think in today's age, we got to think about experience and equity too. I think we need to continually integrate satisfaction, certain like scores. What does it look like in terms of value-based contract for both the customer and the end patient user? There's a little bit to be said about, value and meaningful experience. And I'd like to see us drive more to that realm of things as well.
I think that's an area where, again, as a healthcare system, we've put a lot of energy and we frankly haven't moved the needle so far. And I think these types of platforms have the ability to really define metrics that are meaningful to patients and have them report on them on a regular cadence. I think that type of data is invaluable. And I actually think right for sort of innovation in this space.
Yeah, you're so right. Like as you said that, it kind of like popped in my head. I think when everyone is like focused on the same goal, the same North Star, whether that's better outcomes, better experiences, making sure that the people we serve are really getting the care they deserve, I think then our financial incentives will just naturally follow. Because to your point, it then pushes us to innovate together. It probably pushes us to make sure we're measuring ourselves more honestly and effectively. You start to show up as a true partner. And partnership, I think, is important. It's not like this vendor-customer relationship. I think the ones that are strongest are the ones that are a partnership because you have all those things in mind. So I think it's really well said, Peter.
Almost using this discussion of value to really align on a shared North Star. I think, Kevin, you said, like, are we all aiming for that same target? And even though the perspectives, be it an employer perspective or it might be a payer perspective, a state Medicaid perspective, like if there is an outcome that everybody is trying to get to, and then you're putting dollars, you're putting, risk and you're putting responsibility and accountability behind it. Can that move us all in that same direction and really achieve this? What do you think is the biggest risk in terms of building and maintaining a person's trust with all of these technologies and solutions kind of coming into play?
So I think that is really crucial. And again, I think it's how do we bring these services into the broader healthcare delivery system so they're not fragmented, right? So they really feel part of, a coordinated delivery of services to patients. The last thing I say on the trust issue, and I think how we'll break trust very quickly, and I think unfortunately we've seen examples of this in recent years, is going to be along the lines of these platforms, because they're digital, generally ask for a lot of personal information, whether that's health information or other identifiable information. And I think we've all had circumstances, I have from personal experience, you get a letter in the mail and there's been a data breach and some of your information is out there in the world. We don't know what's happening with it. And you've got 12 months of credit monitoring. Fantastic sort of support after the fact. But I think particularly in this setting where we're dealing with individual health information, we need to be so careful with the security of that and that it's not accessible to people who should never have access to this information. And then two, be very clear with what information you are going to collect up front. Don't have any surprises behind the door. So you start engaging and then suddenly all these other things are being asked of you. I think being very transparent and upfront of the information that will be collected, how it will be used, who will have access to it, what will happen when your engagement with the platform vendor comes to an end. Do they maintain that information? Does it get deleted? Do you have control over that information to some degree? I think all of those elements are crucial. And I think for all of us to think about as I think these platforms grow in their potential in the coming years.
Yeah, I love that. If I can just jump in real quick, Rachel, because I think what both of you said and Peter stemmed your comments. I don't know, they lit something up in me, because the fun part about innovation is everything you said, Rachel. But I think the biggest risk is that we can move too fast on innovation and too slowly on relationship building. and not protecting the things that are most dear to our end constituents. And so you're so right. Like, we get excited about these tools and technology. We can move fast, and we all want to move fast because we got to get to market. We got to make a difference. But sometimes you need to slow down to move fast. I think that's the phrase that we often say. And Peter, your comments, that just really, that kind of resonated with me. I had that light bulb moment that came on. So thank you.
Yeah. No, I think you both have laid out some really productive things that can be done here around transparency, being human-centered, but having, in AI, they say human in the loop, but this is a human being accessible, opening up the black box, not being a mystery who's behind the app. And then really making sure that those data breaches are not happening, that you're keeping that trust when somebody gives you really sensitive personal information, that it's going to be maintained to the highest possible standards. So definitely some good takeaways there. All right, so I want to close this out. And we've been talking a lot about the current environment, but I want to take a moment to look forward. If we could all grab a crystal ball and look into the future and say 5 years from now, here's what these digitally enabled wellness condition management, this is what this space will look like. What's coming up in the crystal ball? What's the highlight of that, or what do you hope the highlight is? And maybe, Peter, I'll start with you.
I hope that patients have a lot more choice in how they can access the healthcare system as a result of these types of services. And they can choose how and when they can engage in their care that is most meaningful to them, right? And I think that's really the potential that I see. And I think building off the discussion earlier, and in doing so, that is coordinated with everything else that they're doing within the healthcare system. I think, to me, that would really be sort of the Goldilocks future that we were looking for lack of a better term. It's producing meaningful results to those individuals, right? They are living their fullest lives because their mental and physical well-being, they are maximizing their mental and physical well-being as a result of engaging in these services.
Love that. All right. We're passing the crystal ball to you, Kevin. What are you saying?
Right. I always keep my crystal ball right over in that corner. It's a great question. I think from that highest simplistic, clinician-based thing, and it's kind of like what we started off with. We started off with some really sobering statistics. I hope that in 5 years, the statistics we talk about can improve. I hope we can start pointing to these digital solutions and the coordinated care, really bending the curve on population health. I got a lot more than 5 years before I retire, but I would love to start seeing some marked improvement in there. I think, what I see in the future too is we talked a lot about these digital devices, remote monitoring, connected devices. I think right now they're still a little bit more passively captured. I think what I want to just start to see them more is just be automatically integrated earlier into the healthcare systems and into the work that we do outside the four walls of the clinic. Everyone's wearing their watches, they have these integrated technologies on our phones. How do we just automatically integrate them into the care delivery system? I think one important thing to me, and I worked a lot in my earlier career in underserved communities. So I really do hope equity becomes not a nice to have, but more of a non-negotiable. I think I hear more and more organizations that we work with are holding us accountable for demonstrating that these solutions work across their entire population, both served and underserved. So I hope that we see more in that space. I think we will, but I think it's incumbent upon all of us to push in that direction. So I think the next wave of innovation is really exciting. I hope that it's not just about more data. I think we have tons of data. I know at Omada we have tons of data, but I think it's about how do we thoughtfully use this data? How do we create the right guardrails around it? And then how do we use it to really, truly, truly bend the epidemiological curve on chronic conditions? That would be, if I had my crystal ball and it's 5 years, I would love to say we move the needle.
I will use my crystal ball for this, where somebody is going into a healthcare interaction and everybody is sharing the same information. It is easily and readily accessible to them in advance. They feel like it can be easily interpreted, and there can be true shared decision-making and engagement between people, their caregivers and family members, their care team members, and everybody who's a part of that. And maybe, if I'll add to my crystal ball, maybe in 5 years, the three of us get back around a table together and compare notes, and we see all of this happening. That will be my crystal ball prediction.
I'm hoarding that. We get heart right now. I'm hoarding that, Rachel.
We'll mark that on the calendar for 2031 then, Rachel.
Love it. Yeah, put it on calendars today so we know
Yes.
that it'll happen. All right. Well, Peter, Kevin, thank you both for your time today, for sharing your thoughts and insights. It's been an absolute pleasure speaking with you. And we will get back together in 2031 and check in on our 5-year predictions.
Awesome. It was great. Thank you. Peter, nice meeting you. Thanks for having us.
Thanks so much. It's a pleasure.
We're excited to introduce a new segment of the Quality Matters podcast called The Patient Voice, where we'll explore the real-world impact of healthcare quality for patients. Patient feedback is an important part of the research and development process for all of NCQA's programs, standards, and measures. I spoke with Brandee Hicks, one of the patient representatives who participated in NCQA's Wellness and Condition Management Working Group, and we talked about her experience with digital tools and how we can make these tools work better for patients. So I'm joined by Brandee Hicks. Brandee?
So I'm Brandee Hicks, and I am here in Metro Atlanta, Lawrenceville, Georgia, to be exact. And I am just here wearing my patient advisory hat and want to share my healthcare experiences as a patient with lived experience.
Brandee, thank you so much for joining today. I'm really excited to have your perspective in this conversation. We talk a lot about consumer-facing and patient-facing technologies and solutions, but we can't really talk about this or have this conversation without patients and consumers as part of the dialogue. Could you share a little bit about your journey and perspective and sort of how that led you to want to participate in the Wellness and Condition Management Work Group?
The reason I want to be involved is, well, I'm always open to opportunities where I can share my voice and perspective as a patient to help inform decisions and create resources and tools that enhance our healthcare experiences. And I'm especially passionate about making sure that we consider all demographics, whether we think about race, gender, age, ability, income, education, geographic location. I just want to make sure that we think about health equity and access to quality care for everyone. When we're providing the services or creating tools, we don't always pause and stop and think through things through that lens. And so I think it's important that we have the patient perspective at the table and whenever possible. Also, professionally, I have a background in public health research and program evaluation. So I do know how important it is to make sure that we are having meaningful measures of quality and considering those perspectives as well. And just making sure, are we measuring the right thing? Are people actually experiencing what we want them to experience? Are they getting the quality care that they need and deserve? So for me, it's just about bridging all those things, like my lived experience, professional experience, and just the things I want to see move forward and make progress on.
Can you share a little bit about how digital technologies have impacted your health or your ability to manage your own health?
Mostly, digital technologies have helped me stay organized and consistent, thinking about everything from appointments to get reminders about the appointments or even reminders to schedule appointments. Also checking results and like my lab work, as well as tracking activities and my progress over time. I really appreciate the convenience of having digital tools so I can access them everywhere and not having to have paper records or my laptop with me all the time. I can maybe access on my phone, things like that. I particularly like telehealth portals so that I can have my appointments with like maybe a mental health provider, as well as even like primary care. Like, do I need to come in for this? Does this rash look serious? Do I have to come in? Or we talk about my test results over, camera instead of going in person? I welcome that. I also use things like, Fitbit, blood pressure app, and things like that so I can see the patterns over time. And I like that it can help you be accountable as well as a little bit motivating because, you see the streaks and you get to earn badges depending on the software and the tool. I like the gamification aspects of some of those things. One of the biggest benefits I've seen too is being able to carry some of those tools into my doctor's visits with me. I'm sure there are lots of similar health portals out there where you can track your lab results and maybe communicate with your doctors and see your appointments and everything. And I like my chart because I can see my test results pretty quickly soon after the appointment. So I may not have to wait like to my 2-week follow-up or 3-month follow-up. I can look and see, not to say that I always understand what I'm looking at, but a lot of times they do have an indicator of what may be in the normal range versus too low or too high. Maybe not having to wait, like I said, until the next appointment or even to see if they call you with an alert. And so it also helps me be like just a more active participant in my healthcare journey.
Yeah, no, hearing that and how you can bring the information from your day-to-day life into your interactions with your doctor. You can be informed about what's going on from the labs, the clinical side, and really put all those pieces together. Because I don't know about you, but sometimes you go into the doctor, you're talking to the doctor, and it's like one little nugget over here and one little nugget over here, and they don't talk to each other. And you have to,
Right.
spend months chasing down what's actually going on. What are some of the challenges that you've experienced or that other patients that you've worked with have experienced when it comes to using these different digital technologies?
Well, I think one of the biggest challenges is around trust. I think that's one of the biggest things that people face and some of the barriers and maybe, deterrence from using some of these portals and platforms and tools that can be helpful. But it is the thing that you do want to know more about, like trust and privacy protections. I would say another challenge is that everything doesn't connect. You're tracking parts in one system, then you have another, and nothing talks to each other. So you may have a primary care doctor that uses one system. They're tracking data in another system. And then you have your own apps and things that you have at home, and everything's on a different platform. And so it can become quite overwhelming. The spirit of painting a better picture or a more complete picture, it'll be great if somehow more of the systems could talk to each other. But just thinking about how things integrate and connect, that's something that patients struggle with because you still have to remember that, oh yeah, I collect this information here, or this is a piece of the story, or
Gosh.
this is something I heard from this provider that I might need to share with this provider too, so that everyone knows what's happening. And I often think about health literacy and tech literacy and just maybe making sure people understand how to use whatever the platform or tool is, as well as if once they do get the information, can they even interpret it and understand it and their comfort with that? Because everything isn't always as straightforward as I think it can be. I feel like we use a lot of language and a lot of different things that it could be just stated a little bit simpler, or just thinking about who the audience is. Now think about like wellness programs that may use a digital platform. And I've participated in quite a few and really enjoyed it. So like maybe there's like a 12-week program and we meet twice a week and we talk about maybe diet and nutrition or exercise
Yeah.
together. And they have like an app with, you can log your goals and things like that. You get really into it. But then when the program is over, it's like, now what? And so not being able to have, maybe sometimes we don't always have the tools to sustain that progress. I know the whole idea is like, oh, you've been doing it for 3 months, so this should be ingrained in you. You can move forward with this and just, go on and prosper. But you may not, you still might want some more of that support because it's like, okay, what do I do next? And so just maybe thinking of little ways to augment those programs when they end or provide some type of continued support within the community, or I don't know, maybe we can't do it, but, I know it's a lot of these things, it costs money, it takes funding. And so it's like, you may not be
Yeah.
able to do this particular model forever, but maybe now we can drop down to twice a month we meet as a group or once a month, just some type of accountability and check-in so people still feel like they're connected and they have that community.
We always talk about continuity of care in the clinical space, right? Like your clinicians and making sure you have that relationship over time. But I don't know if we've really talked about continuity of engagement in a lot of these platforms, and the fact that, just because your 12 weeks are over doesn't mean the resources and the way that you're engaging is just kind of like, okay, we're done. We're over it.
A lot of times we used to think about, okay, you do everything in person and then now there may be a digital tool to augment this. And I feel like we still, like now this conversation is mostly about digital tools and digital platforms, but how can we use in person or real life to augment that? So how does what we're learning or what we're seeing online or in the digital space translate to what's happening in reality? So I have this wellness app and it's like, oh, you need to eat more vegetables. You need to do this and do that. But can I get that in my community? Where can I find this? I need to walk more. Where are the trails near me? That kind of thing. Like you're telling me to eat like turmeric and goji berries. Where is that? Because these are things that I only
not my
recently heard
grocery
about.
store.
Exactly. So where do I find these things? So making sure we understand, like, like that goes back to kind of more the customization or just thinking about individual needs. Where I live in Metro Atlanta, I can get a lot of different things, but where someone lives in like rural Georgia, they may not be able to have easy access to some of those things. So does the tool know that? Do they know where the nearest place where you can go and get avocados are, or different things, like how you might actually integrate whatever that is that your goals are on these wellness apps or through these portals? How do you get it in your real life so it can translate there and you can sustain your progress?
Thank you so much, Brandee. Really appreciate your time today.
Thank you.
From what we heard from Kevin, Peter, and Brandee's insights, a few key themes came through loud and clear. First, there's an opportunity for these digital wellness and condition management solutions to meet people where they're at and to really and truly be patient-centered. But we have to be mindful and intentional about equity and that we're not creating inequity or leaving any populations behind. Next, when done right, these digitally enabled solutions can support better care integration. But we also have to be careful not to add to fragmentation. Care teams need to know what their patients are participating in, and the data needs to flow between settings. And that doesn't mean relying on the patient to be bringing the data everywhere with them. Next, we need to be building and maintaining patient and consumer trust, and this is really critical. Where's the data going? How is it going to be used? Is there transparency? Nobody wants any black boxes. Where is the human behind the scenes of these digital technologies? And finally, there's a real opportunity to shift to an outcomes-focused approach and be open to a range of outcomes: clinical, behavioral, utilization, and patient-reported outcomes. And underlying all of that is the need to measure real, meaningful engagement with these tools and solutions, longitudinal engagement that goes beyond app logins and really gets into interactions and changes in behavior. Thank you, everybody, for joining us and listening to this episode of Quality Matters.